typically we tend to think of the two realms as separate, the social policy and the innovation policy, right? What the Brazilian case demonstrates is how social goals can drive innovation.
Welcome to the Delve podcast, where we explore pressing questions in leadership and organizational management. Today, we're talking about innovation in the Global South. In their fight against neglected tropical diseases, the Brazilian government made it a priority to develop innovation capacity within their borders, and their methods could be a blueprint for other countries hoping to do the same. Professor Paola Perez-Aleman, an associate professor of strategy and organization at McGill University, closely studied Brazil's tactics. She joins me to discuss what they did, how it helped, and what it means for the Global South. My name is Sabine Dhir. I'm a faculty member at the Desautels Faculty of Management and acting director of the Marcel Desautels Institute for Integrated Management at McGill University, and I'm your host today. Hi everyone, I'm here today with Professor Paola Perez-Aleman. Today we have the chance to discuss her recent research on a topic that I think has global and broad interest for many people, especially right now in the world. The research paper that we're going to be discussing is called Creating Innovation Capabilities for Improving Global Health, Inventing Technology for Neglected Tropical Diseases in Brazil. Professor Perez-Aleman, it's a pleasure to have you here.
Thank you. Thank you for inviting me.
Can you provide an overview of the study and its focus on specifically building innovation capabilities in the environment that you were looking at?
This case addresses the innovation efforts around neglected diseases, which affect more than 1.5 billion people around the world. These are chronic infectious diseases that also cause the death of more than 10 million people per year. And they are a very significant economic and social burden in many countries in the world, particularly those in what we would call, tropical climate, right? Because these are tropical infectious diseases, most of these neglected diseases defined by the United Nations. So the addressing these diseases is central to global health.
So typically and historically, what has been the relationship between innovation and neglected tropical disease?
Well, historically, I think the best, statistics are the ones that were produced by studies, let's say by Doctors Without Borders, and the studies had shown that only 1% of investments were going to address neglected diseases. Okay, 1% of research and development investments in health were going to neglected diseases. So you can imagine, and I think that that figure that they publicized, that 99% were going elsewhere, really brought to light this idea of neglect and the call to do more research and development in this area. But just think what happens when you have places like in Latin America where millions of people, let's say decades ago, have been affected by a disease like Chagas, and you know a lot about the epidemiology of the disease. However, how do you know that people actually have it, to do the diagnosis? So many people would not know that they would have it because in the past, let's say you may not have had diagnostic tests. Or how do you treat it? What are the ways to address the treatment of these diseases? So what you have in many parts of the world with neglected diseases is the lack of diagnostics that you don't even know, right? So you have, damage, to your health, but, what is the underlying cause? And if you don't know that you have it, how can you treat it? Or if you haven't done research about what are some of the possible treatments, how will you develop treatments for these? And so that's the reality.
One way to build innovation, and a really key way to do that, is for developing and emerging economies to start building and investing in creating knowledge networks. So what are knowledge networks?
When we say knowledge networks, we're talking about the ties and interactions that contribute to knowledge flows, to knowledge access, and to knowledge creation, right? To knowledge recombination. Just to note that in my context, knowledge networks is referring to the ties and interactions between organizations. And part of the challenge was understanding which organizations are we talking about? Are we talking just about private organizations, or, companies? Are we talking about public organizations, government, or are we talking about universities, other types of organizations? So part of that, we need to understand, how that's coming about.
So who is involved in knowledge networks in this particular context?
In the 70s, let's say in the 80s, most of those ties that they were building for production capabilities were mainly with foreign multinationals. What was happening as they were trying to build, R&D capabilities in these new, to target these new diseases, is that they were growing ties, not just with those same companies, but with many more companies, foreign companies, and also with different local actors in Brazil, by also building more capabilities of their local universities, and also with universities around the world, and as well as with research centers, public research centers in other parts of the world. So their effort to build these knowledge networks grew locally as well as internationally. But what's interesting also is that as Brazil kept growing its research and development capabilities from the public sector side and from the plural side in universities and all that, private companies also became more interested. So it actually attracted more companies from different parts of the world to join in.
So you're describing such a shift in innovation dynamics. In this case, Brazil is able to assume leadership and agency, which is different than what we've historically known.
Yes, and that's important. So that's, I think, what you're talking about, the agency, is that this isn't happening because some foreign actor over there is doing it, Chagas, is that they're really saying we need to address these local health problems. And what's interesting here is how it then influences the innovation policy, because health became a priority for innovation policy too, right? And typically we tend to think of the two realms as separate, the social policy and the innovation policy, right? What the Brazilian case demonstrates is how social goals can drive innovation.
What was the role here in terms of the Brazilian government, and what was there a role for them in ensuring that social innovation and innovation for innovation's sake were able to work together?
In the case of Brazil, the government, let's say, had, three, I think there were three types of actions there. One was at the policy level, setting a priority to increase access to health for the local population. Secondly, they put investment behind it. If you look at their investment, their budget, that they invested heavily. And part of that said, we think that health is crucial for not just socially, but for the economy. And we're going to make health a key driver of our innovation policy. And third, the other thing that they did is that they strengthen their public research organization to move to more R&D and to articulate networks, local networks and international networks, to do more R&D.
The study that you are talking about with us today, it introduces a very different strategy when it comes to neglected tropical disease innovation that's driven by these developing and emerging economies and the public and civil society actors that you've identified. How does this particular strategy follow a South-South knowledge flow?
In the case of Brazil, they made it a priority to build capabilities in other countries.
Right.
And we could see that the Brazilian research organizations, particularly the public research organizations like Fiocruz, they established a lot of partnerships with other countries, let's say in Peru or Colombia, in Argentina, but also with other continents, like the ties that they established with India,
right,
with Malaysia, around, the issues of malaria were relevant. And in fact, Brazil developed some technologies that were then transferred to India so that they would then have the capabilities to produce them. So that South-South collaboration, particularly when it comes to neglected diseases, is relevant in all the phases.
So this alternative pathway, it really challenges that traditional unidirectional flow of knowledge production that's north-south.
Some countries have become proactive
right.
in the South about changing that role,
right,
of simply being recipients, let's say, and sort of waiting, particularly when it comes to diseases that countries in the North or companies from northern countries may not be prioritizing. The interesting thing about that is also the role of foreign multinationals, right? That, let's say, traditionally, like you said, this unidirectional flow, right? What did that mean in the past, right? Was that the research was being done, let's say, in the northern countries, in the U.S. or in Europe, and then the companies there also would do, let's say, perhaps when they did the R&D for this, and then this would be transferred, right? Mm-hmm. It would be brought to the South. And, that remains important, obviously, with technology transfer. The issue is that when countries from the South become proactive about building capabilities to do research and innovation, they are actually integrating the companies into those research collaboration efforts, right? So they're actually, while the companies may not have them in their R&D portfolio, right. What's interesting about the networks that are being activated by countries like Brazil, let's say, or by these other countries that are part of this global network collaborations like this drug for neglected diseases, is that they bring these companies from the North to be part of this consortium that integrate organizations from the developing world, right, where they are then doing more research, they're doing more patent development, they're engaging in a lot more development, a lot more discovery.
What would you consider the real tangible impact of these knowledge networks and Brazil having such leadership in these collaborations and becoming a model for how developing and emerging economies can drive their own innovation? Over the last 30 years, what has been the impact of this?
Well, I think one is that is a change, I would say, of mindset too, in the sense that in the past, perhaps you were mostly engaged in bilateral partnerships, expecting to mainly be engaged in production, right? In local production of what was developed elsewhere, invented elsewhere in the North, and that you were mainly focused on production capability building. Right. And I think that it's a huge shift when you're saying we have diseases for which we need solutions that are not there yet. We have local problems that are a priority in this location that we need to address. Right. And you cannot be, waiting, let's say, for interest in this, right, from others.
To make the decision.
For someone else to make the decision. Exactly. So I think the idea of making it a priority to address, a local social problem, in this case, let's say a health problem, and then saying, what do I need to do then in terms of innovation policy, in terms of the investments, in terms of capability building, in terms of skill building? That is a huge change because it's expanding development.
And this is in addition to, that there's previously non-existent projects in multinational portfolios that have emerged through these collaborations.
Yeah, and you bring an important point there also that we found through this project, which is that the portfolio of the multinational companies also expands, right? Because you tend to think that the driver is happening, for innovation is happening within the multinational companies. And what you see here is that the social and innovation policies of countries in the South also influence, right, the innovation strategy of multinational companies. And in this case, they also join those, right, and expand their efforts. So that I think is also interesting, right, in terms of how we think about multinational strategy.
What would be the key factors if we were to utilize some of this research and say we want to really strengthen these developing and emerging economies' ability to address health-related challenges around, let's say, the Sustainable Development Goals? What would be the best practices that other developing and emerging economies should consider adopting?
Right. First, I would say that it's really important that locally social and innovation policies are somehow brought together, let's say, in terms of how the social health is a priority. Well, how does that translate to innovation policy, and vice versa? How does innovation policy also address, the important social goals locally? And in a sense, we could see as something similar with the environmental goals, right? We could see that I think that this is very relevant for that also. If you have environmental improvement goals and we have environmental crisis, how does that align also with our innovation policy goals? Right. And vice versa, how does innovation policy address those environmental crises or environmental challenges? A key aspect of the process of building capabilities is activating those networks so that complementary knowledge can flow, so that knowledge can be accessed, but also, importantly, to create knowledge that brings that diversity, which we know is so important.
You've outlined here how the creation of knowledge networks and developing emerging economies being able to drive innovation and to facilitate innovation, using their own expertise and knowledge leads to so many benefits, right? In terms of the country itself, that the ability to address huge, significant challenges, the benefits that there are to the multinational organizations and how they in turn end up having their own internal innovation and driving profit, and the collaboration capabilities here that occur across countries, whether it's south, north, south, and being a part of this network, whether you're an institution that's a research institution, a university, local production facilities, it sort of lifts everyone and allows them to have this conversation that there's a giant, giant goal.
Well, at this point on the universities and support for universities, I think that when we look at the patenting activity data in Brazil around neglected diseases, the presence of the universities, their local universities, is dramatic. And that was not, as I mentioned to you about the curve, right? And when we look at it, let's say if you looked at it in the 70s or if you looked at it in the 60s versus you're looking at it in the 2000s, there is a change there. Even this increasing activity then of universities, not isolated, but also connected, right, to other universities or connected to other public research organizations. That matters a lot because you're building the capabilities. You need, the trained people, right, with the scientific capabilities. You need to produce that. And you need to build those research capabilities, and you need to translate that, obviously, into, developing products. And then that also goes into the other organizations that are involved in the R&D. So I think that is crucial also, building the capabilities of those universities.
I want to thank you, Paola. This has been such a fascinating conversation. As someone who's, I care a lot about trying to figure out how do you get different organizations and different groups of people with different expertise to work together. Your research shows that it is possible over a period of time. So thank you so much.
Thank you for the great conversation.
Thanks for listening. I hope you enjoyed that conversation as much as I did. It really is a testament to what can happen when we bring diverse people together. Don't forget to like and subscribe for more insightful conversations from Delve. And if you learned something today or found it at all interesting, please tell a friend about the show. It really helps. Delve is the official thought leadership platform for the Desautels Faculty of Management at McGill University. This episode was hosted by Sabine Dhir, and Dicaire edited and mixed the show. Original music is by Saku Mantere.